Okay, so we want to thank everyone for coming to our session today. And this is, as you know, our uh, not we have one more sessions after this. So this is our grand round seminar, and we are so honored today to have as our guest speaker, Dr. Kaye Bender. Dr. Bender, as many of you know, for a really long time, has had multiple positions, particularly here in the southeast part of the United States. Some of you may know her from her FAB, which is the Public Health Accreditation Board, and now she is serving in the role of executive director for the Mississippi Public Health Association, and at the same time, which is I guess par for who she is, and her wonderfulness is that she's also the APHA president. So we are truly honored to have her. And I will leave it at that and let her add any other introductions you have. Just a reminder, please, stick around for a little bit to ask questions of Dr. Bender, and then we'll make one last closing announcement for that. So without further ado, I'm going to turn it over to Dr. Bender. And so plus, we just here, welcome to Southern, and welcome to our community.
Thank you, Dr. Tilfair, and it's really good to be with you guys today. I have a special place in my heart for your School of Public Health because you were one of the first to reach out to me in my role at FAB, and actually those were the days when we did in-person meetings, and I got a chance to speak to you all then. So it's great to be with you today. And I look really forward to our conversation. So I will try to go through this presentation rather quickly so that we'll have time to talk about this. And today we're talking about collective voices. So how we in practice, academia, and certainly through APHA can speak for public health. So a collective voice to me is the voice of a group. And the group could either be a community, a particular racial group, a gender-specific group, et cetera, or it could be all of the above, which APHA is. You know, we have a 25,000 member group. And what makes it collective, and what I love so much about public health and what we do, is that we speak with one voice when it comes to issues related to public health. Dr. Alan Hinman, who was past member of the executive board and for several years speaker of the APHA Governing Council, talked about APHA being like a family, that we have successes and failures and celebrations and disagreements, but we're kept together by a bond of commitment to improving the health of people. And that's what I love so much about being able to speak with you, because I think whether we're in practice or whether we're in academia or both, or whether we're engaged in an association like your state affiliate, and or APHA, we are kept together by this bond, and that bond is what I want to talk about really today. I don't have to tell you that both practice and academia have been under some of probably the most significant challenges that any of us have faced. Public health jobs are complicated anyway, as you all know, but the COVID pandemic has put a pressure on the public health workforce and for those who teach our students and for the students, as we've really gone through some really uncharted waters and have also had personal pressures. So I want to acknowledge that today. We'll talk a little bit about how we got there, but I don't want to dwell on that, because what I really want to talk about is my optimism for the future, and I am optimistic. But first, we do have to acknowledge the elephant in the room, and that is COVID. If you're like me with COVID and its variants, you'll be very glad when we are able to stop talking about it. But I suspect it'll be a while. So I want to use my home state of Mississippi as a case study, not because I'm proud of what we've done, but I do think, like Georgia, like many other states in the Southeast and in the Midwest and in other parts of the country, our state story is not particularly different. So you can see here in Mississippi since the pandemic began back in the spring of 2020, we've basically had 3 surges. And, the one in July of 2020 was really, before vaccines and right after we saw people begin to sort of get back together for the summer celebrations. And then in January of 21, after the holidays, and then for whatever reason that we'll talk about a little bit, another surge in the fall of this year. So we still have COVID. In our state, we have almost 3 million people, and we've had 500,000 cases of COVID documented and about 10,000 deaths. Most of our deaths is long-term care facilities, nursing homes, assisted living, personal care, and of course, like most of the country, the surges have really affected them, and we still have outbreaks occurring in the facilities in long-term care. And much like the rest of the country, our cases, our hospitals, and deaths are largely in either unvaccinated or partially vaccinated people. And we're struggling with the vaccination myths and the reluctance for people to want to mandate the vaccines. I'm not proud of that, but it is a factor that we're dealing with, and I suspect many of you are as well. If you look at the vaccine status by age group for hospitalized cases, of course, the non-vaccinated you see here hopefully showing up in a deeper blue, and the fully vaccinated in green, and still, still tells the story, just shows it in a different way, that the majority of the people who are hospitalized are either unvaccinated or only partially. And unfortunately, our deaths, while largely are in the older age group, you can see there we've had a few deaths in the 18 to 24 and the 25 to 39 age group as well. So it's not something, again, that we're particularly proud of. Our state health department, we are a centralized state health department system, so health departments who are local are really arms of the state health department. They've done an awesome job. Our state health officer is appointed by a board, not by the governor. He is board certified in infectious disease, has master's in public health, so he's well prepared to be where he is, and has laid out some really good plans. We've, like your state and others, we've had drive-through clinics, we've had pharmacies, still do have pharmacies giving vaccines. We have what they call pop-up clinics, particularly in the more rural areas and the communities of color, where there may have been reluctance to or difficulty in actually getting to one of the other sites. And in spite of that, we are still dealing with the anti-public health messages. And as I've traveled across the country, and of course, for those of us who were at APHA in Denver, either virtually or in person, we certainly continue to hear these anti-public health, anti-science messages. And the reason I bring that up today is because it's not necessarily new information at all, but it has certainly taken its toll on our public health workers across the country. And I do want to talk about that today. This is a cartoon, but unfortunately most of us don't find it as funny as it was probably meant to be, and that is just this whole thing about people who look up their own information on the internet tend to believe what they see there, whether it's science-based or not. And our clinics, physicians, hospitals, healthcare providers, and the public health departments are still dealing with trying to dispel that information. We, being a rural state again, you're going to hear a lot about rural through this talk because part of my concern about this whole country is the disparities that rural has sort of shown through the COVID. We knew the disparities were there, but COVID has pointed them out. But we are rural, we are agriculture, we've got a lot of farmers, and we've had a lot of folks who have, in spite of the best science, have believed and tested on themselves ivermectin for COVID. And so while this too was designed to be a cartoon, it hasn't been particularly funny or easy for us to deal with. And I heard at APHA that many other states are dealing with that too. And then, of course, there's the media. And I'm sure you've seen this chart. A lot of people are using it. It's the result of some research that was done by the Ad Fontes Media Group, just looking at what the public feels is the most reliable media, and then those which tend to go to the left, to the right, and hyper-partisan or most extreme. And the real thing here is, not many of them that our typical audiences listen to are in the middle. They're somewhere all over the place, and that has also contributed to the frustrations on the part of the workforce, as well as our ability to really contain the pandemic. You might note, I always get a kick out of this, that the Weather Channel is right up there as being one of the most neutral media outlets. And I guess for those of us who live in hurricane and tornado areas, that's probably comforting to know. What I really want us to talk about collectively, because your School of Public Health and those of us who have a foot in the door of both academia and practice, I think could all agree that the public health services are only as good or as strong as the workforce that delivers them. And I am worried about the public health workforce, but I'm also optimistic that collectively this year will be time that we can really put forth some effort to strengthen our workforce. You probably know about the Public Health WIN survey that the DeMont Foundation, ASTO, and NACCHO do every year. It's the only survey that I know of that actually asks the workforce themselves, what are their needs and interests, and what are their concerns, and what is their satisfaction. And this is 2017. Typically, Beaumont would do this again, would have done this again in 2019. or at least early 2020, but because of COVID, they have waited, and they do expect to put the survey out again soon so that we'll have really COVID-related data for 2022. But I think what you see here is just the fact that the state and local public health workforces were already stressed. They had already shrunk in terms of numbers, and all the pandemic did was to make that worse. When we look at our friends across the aisle, so to speak, in the health workforce, we also saw a shortage of physicians, nurses, laboratory personnel, school nurses prior to the pandemic, and it's gotten worse. And then, of course, the behavioral and mental health workforce shortage is also raised its head here as a huge part of public health because of the exacerbation in mental health issues due to COVID. So we've got some work to do just in terms of our overall public health and healthcare system in terms of our workforce and staffing. And then you might have seen a study in April of the MMWR where it talked about symptoms of depression, anxiety, PTSD, and suicidal thoughts among really governmental public health workers. And the key takeaway from this slide is that of 26,000 public health workers in the governmental agencies that were surveyed, half of them reported symptoms of at least one mental health condition. And if you dig down through this paper, that's considerably increased from studies in the past. So the summary there is if I wanted to sound like a Debbie Downer a little bit before I start talking about the optimistic side, is that COVID has highlighted many of the challenges we already knew, but has exacerbated shortages. We know we need greater diversity and representation, and we know that we have areas of greater disparities and underserved areas and populations that were already there, but like in the rural areas, but have been made worse by COVID. We do have, on the optimistic side, however, as you know, a fair amount of funding through the CARES Act and the American Rescue Plan Act to shore up our public health workforce. And so there are a lot of questions, as I'm sure you know, that are going on around the country about how do we ensure that these funds are best used, not only to end the pandemic, but to support communities and their workforces to be able to come back stronger and better. And how can we make sure that these are not flash in the pan, if you will, kind of funding, but make substantial and long-term sustainable changes to support our workforce. So I want to talk about four initiatives here for the future public health and its workforce. Some are not new, some are just I'm bringing up because I think they're certainly part of the solution, and then there are a couple that are newer. So let's talk about public health as a profession. There's been a fair amount of discussion in the public health community, as there kind of always is after there is some kind of major event, like after 9/11, like after H1N1, and like we experience in the South after hurricanes and floods and whatever, that we really think about ways that we can promote public health as a strong profession. And I know I don't have to sell you guys because you are one of the premier schools of public health. But within the discussions nationally about public health as a profession, we really have three cornerstones here, and that is the credentialing of individuals, the accreditation of the health departments, and the accreditation of the schools. So you all know, because many of you have promoted, I understand, the credential certification in public health, which is aimed at assuring a common body of knowledge, a competent workforce, and profession-wide standards. The National Board of Public Health Examiners has been around now for about 12 years, have tested a little over 11,000 individuals in 95 countries. And if you look here, I guess the one takeaway here is, in spite of COVID, that the interest in certification of individuals by the National Board of Public Health Examiners reported a 40% increase in 2021. And of course, most of those were among students. But we have seen some increase in the workforce. As a reminder, and I want to show you this because I want to draw the parallel in a minute about how all three, individual credentialing, accreditation of health departments, and accreditation of schools and programs in public health, really work together to ensure that the domains are aligned with each other. So these are the domains in the CPH exam. And you know that graduate students of CEF accredited schools and applicant schools are eligible. But what a lot of people don't know is so are the members of the workforce who have 3 years experience and a graduate level related degree or 5 years in a baccalaureate degree. So that's one of the reasons we've seen an uptick in the workforce. This is a slide that shows the schools that actually require the CPH exam as part of their graduation efforts. And this is one, for those of you who are faculty, you may be interested in, you may or may not know, but the National Board of Public Health Examiners, through the ASPPH, Association of Schools and Programs in Public Health Data Center, allows you to be able to look at students who sat from your school, who sat for the CPH exam, and how they scored in each of those domains that I showed you. So it's also, from the school and faculty standpoint, a good way to be able to track what your students learned as they went through your program. At the same time, you all know that this last year, 2020, actually, the Tennessee Central Public Health Services celebrated its 25-year-old birthday by refreshing. And I was pleased to be able to facilitate that process. There's a couple of things I want to show you that changed. You'll see the three core functions on the outside: assessment, policy development, and assurance did not change. The majority of the 10 essential services did not change. But two key pieces. In the center here is equity. It used to be research, and we still think research is important, but the whole cornerstone and framing around building a more equitable society and a more equitable health status for all people who live in our country became the cornerstone. And we moved research over here in that sort of deep purple, and combined it with quality improvement, innovation, evaluation, and that piece. And so that became a little bit different. And then the one new piece is building and maintaining a strong organizational infrastructure. So just as a reminder that while these 10 essential services do form the basis for accreditation of health departments, these are actually there for any of us, whether we work in government, in academia, nonprofit organizations, or in health systems offering population health. This is our framework. And I think you can probably already see some consistencies with the domains for the CPH exam. Then if you look at the accreditation of schools and programs, you'll see that many of the domains that SEEK uses for accreditation of schools and programs are also very similar. And if you're interested, I can send Dr. Telfair a copy of an article that actually I co-authored a couple of years ago with Laura Razor King from SEEK and Allison Foster from the National Board of Public Health Examiners, where we actually draw those distinctions. Professionalization of the public health workforce, talking about it as a profession, and being supportive of public health as a strong and necessary profession will be very important as we move past COVID. You may or may not know about the work. I am so excited about this, and I really wish I could tell you more about it than I'm going to be able to tell you today. But the Bipartisan Policy Center released a report in June about positioning America's public health system for the next pandemic. And that's a great report. And if you're interested in that read, then that's on their website at bpc.org. But what I'm the most excited about is over the last several months, I've been pleased to represent APHA along with Dr. George Benjamin and a host of other people from other public health organizations to be part of a roundtable series of discussions about how we move public health forward after the pandemic. The report that we developed is about 55, 60 pages, and it's embargoed until December the 2nd. But on December the 2nd, and after that, we'll be able to talk about the details of that report. But I really want to encourage you to watch for that report, and I can also alert Dr. Telfair if you're interested in it, because it talks a lot about the workforce, the infrastructure, and what we actually need to build back a resilient, strong public health system. And I have to tell you, I am a champion for all of the recommendations that are included. And there are recommendations in there for the federal level that have to do with changing the funding mechanisms. There are recommendations at the state level and at the local level. So I really hope you'll have a chance to take a look at that report. And then the last new thing that I wanted to mention to you is a partnership of the DeVomont Foundation along with about 50 other organizations who form the National Consortium for Public Health Workforce Development, not for the purpose of establishing another organization, but to talk about what the workforce is going to need in order to move forward past the pandemic. And the consent agenda, they use the collective impact framework. The consent agenda has the components here that you see, but it's all about health equity and the workforce skills that are needed there, innovation and change, and the fact that governmental health departments have to be able to be comfortable with a culture of innovation and change, and then knowledge of unique experience and perspective of those who live in the community. So a real strong, a real deliberate, and a real meaningful and an intentional partnership with members of the community. And you see there, one of my favorite topics, and I know Dr. Telfair's as well, rural health departments and the whole concept of rurality. You can Google Public Health Workforce Consortium. The website is now up, and you can see many of the resources. Again, this is not a new organization. It's not meant to duplicate anything that other organizations who have a history of working on workforce is doing. They'd rather be a hub to come together to really discuss new and innovative ideas. So as we move forward post-COVID and we look at public health's role, still working to create resilient communities, promoting a deeper understanding and action on health equity, moving past the important statement that racism is a public health crisis, but moving past that into, okay, so what are we going to be intentional about doing about that? Reinforcing that public health bases our work on science, facts, and evidence, supporting and enhancing the workforce, and that's the full trajectory from the numbers of them, the recruitment and retention, as well as their mental health and professional development. Championing the connection of local to state, state to region, and regions to national so that we see a more seamless public health system than we've seen in the COVID pandemic. And then understanding and promoting access to health care, including mental and behavioral health. One of my favorite quotes about public health in a post-COVID era actually came from Dr. Tom Frieden, who's with Bloomberg now, but a former director of CDC, as you know, and I interviewed him not long ago for a podcast, and he said what we really need in a post-COVID era is a public health renaissance. So before I close and we take questions, and I am very interested in your thoughts on anything I've said or anything I didn't say that you thought I should have. I'd be remiss as APHA's president not to remind you that APHA is 150 years old this year, and we will be, this coming year, 2022, we will be celebrating all year with a theme a month, and you'll see that campaign roll out soon. The executive board, actually, when we met in Denver, we said, you know, the 150th anniversary of the oldest and largest public health organization really should give us the opportunity to use our collective voices to talk about what public health needs and for us to be our own advocates. Sometimes we're reticent to talk about just how great public health as a profession is and what a good job our workforce does with tremendous challenges. But the APHA Executive Board is challenging all of us as we get into the 150th year to strengthen our commitment to equity, diversity, and inclusion. And this year, APHA will add justice to that array of work. And now, if I can get it to work, I want to show you a real quick YouTube, and then Dr. Telfair will be able to take questions. So let's hope this comes up. So I just want to end by saying thank you for all the work that you guys have done at the school, whether you're a student, whether you're faculty, or whether you also have a foot in the practice door. All the work you've done over the pandemic, all the work that you're continuing to do. I feel very honored to be part of the public health profession and to work with you. Oh, good, there it is. Can you all hear it?
No, we can't hear. We can turn the sound up.
While we're waiting for that, I also want to acknowledge Dr. Telfair's wonderful contribution to APHA and his leadership. And also, I believe Mandy Marshall is on the call. Mandy's a current board member and is also exercising great leadership, and it's a pleasure to work with both of them.
Thank you.
Amalola, you may want to unmute your screen. And
unmute yourself and turn the sound up on the screen.
Okay.
Yeah, both of those need to be done.
I unmuted my first name. So you can unmute now. Yeah, I'm unmuted. I did it.
Okay. What we'll do is just put the video. You can just stop the video, and what we'll do is put it in the chat, and we'll allow people to just copy it that way. So Ms. Oka-Ramadi, if you can just give the screen back.
Yeah, that'll be fine. I'd love to have some time to talk with you guys about your thoughts. Is there anything, any questions you have, or anything that any of you guys would want to comment about the workforce or APHA's role?
Do you have any comments or questions for Dr. Binder? Okay, well, I'll start. Can you, given that your extensive work that you have done in our region of the country, how do you view where we are going in terms of workforce? Basically, because we've lost so many people, and we, you know, there's the training itself is and the production itself is not keeping up with what it is, you know, how we're producing folks and training folks. I was wondering, do you have any insights for us? Because right now that is a big focus of our college, particularly in the rural parts of the country.
Yeah, thank you for that question. I wish I had a magic answer to that. We were already struggling, right, to recruit people in the public health. I do understand, so a couple of things, Dr. Telfair. I do understand that enrollments in schools and programs in public health across the country, including the South, are up. I don't know if that's true for Jiann-Ping at GSU, but I'm hearing that across the country. So I think that is great. I think but part of what the conversation with the Bipartisan Policy Council has been is that we have to really, both for our existing workforce and for our pipeline future workforce, we really have to talk about this assault on public health as a place to work, and also the assault on science. and really strengthen our public health workers' ability to be able to deal with this enormous divisive politics. And we see that in the South, I know probably more than any other part of the country, unless maybe it's the Midwest. I know our state health officer here, as I mentioned, has just done an awesome job, but he's had death threats. His kids have been threatened. It's been enormously difficult for him. So it has also, and if he were here, he would tell you, it has reminded him that it really does take a village. And so while he's the state health officer with the credentials, he's got the responsibility, he has really leaned on, I think appropriately so, his colleagues in the Medical Association, in the Nursing Association, in the Public Health Association, and others like that to help carry some of the messages. And so I think we have to also strengthen our workforce comfort level with sometimes, depending on the politics, the best spokesperson or spokespeople may not be the one who's the public health official. It might be some of the rest of us who are in different positions.
Thank you. Any other comments or just questions for Dr. Bender?
I'd be curious to know if there's anything you guys would recommend that either I, as APHA president, or that APHA itself do to champion the connections between practice and academia and APHA so that we can use this post-COVID window of opportunity to strengthen public health. Do you guys have any thoughts about any of that? It's a quiet group today.
It's a quiet, yeah, today is a quiet group, but we will. Yeah, Ms. Robinson mentioned more training for students entering the workforce as a suggestion.
Yeah, Carlene, do you have thoughts on that? With that, I'm just going to be assume a little bit here that may just be on the realities of what we've learned during COVID and how to cope with some of those realities. Is that kind of what you're thinking?
Yes, I think also like about mental health struggles and learning how to deal with not having a lot of resources and making sure that you're talking to the right people and finding those networking opportunities. We can say it very well now that we're all kind of like mid-professionals, but I think in the beginning that seems very hard to take on while you're also trying to take on a new job. So I think kind of lowering those barriers for new people entering the workforce would kind of make it not so scary.
Thank you. That's a great suggestion. There are some resources on the APHA website that actually speak to the mental health aspects of working in public health, particularly now. And Carlene, you're right spot on, and that is to go ahead and build that into your professional development plan. And whether that is something as simple as having a support system, that's maybe not a family, but I bet Dr. Telfair does too. I mean, I have 4 or 5 people that have been my go-to support people for most of my career. And they're the folks that I can say X, Y, or Z is driving me crazy. Is it me, or do I need to look at this differently, or whatever? I call them my kitchen cabinet, although that has nothing to do with anything. It's just a fun name, and periodically we all get together and just kind of share. So I think having that support system is really important, and just building in mental health. I was privileged last week to be in Rhode Island. Their Public Health Association meeting was in person. And I was privileged to be there to speak, and got to visit over at Brown University for a little bit. And their mindfulness center is really reaching out now to the public health and the healthcare workforce, and with an eye toward the social determinants of health, which I thought was very interesting. And even as the public health workforce and the healthcare workforce, those social determinants of health apply to us as well. So we too have genetics to deal with, and sometimes transportation issues, and sometimes we're trying to take care of kids and elderly people, our parents or others, and all of those are stressful. And so I'm hopeful that this concept that Brown described to me, Carlene, will also be something that we can just understand and accept that there's a behavioral mental health aspect to all of us being healthy, and that includes our public health workforce. Thank you for that suggestion.
Yeah. Thank you, Dr. Bender. So that will be our closing question. We truly appreciate you coming and speaking with us, and also just making efforts to interact with us. Reminder to everyone that, and interesting that you're talking about the mindful self-compassion, because remind everyone on the 1st of December, that's what our seminar is going to be on as we close out our seminar series for this semester. So thank you for bringing that up. So as we close out, again, much thanks to you, Dr. Bender. We'll follow up with you as it is. And a reminder to everyone, please attend our upcoming last seminar on the 1st of December. And as a reminder, if there's additional or speakers that you think we should invite, particularly national speakers, please let us know. We'll follow up with you. And then thanks to everyone who has done that. So thank you for your time, and we hope you enjoy the rest of your week. Dr. Bender, blessings to you and to my good bud Danny. And we'll take y'all, follow up with y'all at a time. So thank you, everyone.
Guys.
Everyone's thanking you. We appreciate it.
Happy holidays next week.
Okay. Thanks, everyone.